The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. We're glad that you've joined us today. Today we're going to be talking with Dr. Tim Arnott. Dr. Arnott is a physician at the Lifestyle Center of America in Oklahoma, where he helps treat the major diseases in the Western culture and treats those through lifestyle. And today we're going to be talking about something that afflicts 1 in 3, some statistics say, 1 in 3 American males. That is cancer of the prostrate. Did I say that right?
Prostate, that's right.
Prostate. And tell us a little bit about this. Is there any good news that we have about this thing that commonly afflicts most American males?
Well, there is good news, and the good news is that there are many researchers today who are looking into the underlying cause of prostate cancer. And they're coming up with some very interesting information, and one of the things that we can start off with is that there are important nutrients that the body needs to have a strong immune system, to have a strong ability to fight off cancer.
And so that's good news? How is that good news?
Well, it's good news because we can add things to our diet, we can add things to our lifestyle that can actually lower our risk for this important disease.
Okay, so the good news is that we can actually eat things or do things that help us not be one of the statistics, the 1 in 3.
Absolutely, and I would mention right at the outset here that this information is not only important for men and for avoiding prostate cancer, but it's important for avoiding cancer in general, so it's also important for women.
Okay, so you women that are watching today, come back. Don't
leave.
Don't leave us. This is going to help you as well.
We're going to be talking about physiology, and we're going to be talking about how the Creator has designed our body so that if you cooperate with His physiology by what you eat, what you drink, what you do, you can strengthen your ability to fight cancer.
Well, some people have said there's a substance called selenium that protects the prostrate?
That's right. There's studies going on right now looking at prospective studies where they're giving one group placebo, water pill, they're giving another group selenium.
And what is selenium?
Selenium is a trace mineral, and it's found in whole grains. I emphasize whole grains because most grains that Americans eat are refined and processed. We call it enriched in this country. But it's one thing they don't put back is selenium.
Okay.
And selenium is important because there is an enzyme system that the Creator put inside of our bloodstream, and this machinery, its job is to mop up, to get rid of, to sponge away free radicals.
Okay.
Free radicals are highly reactive, highly unstable oxygen chemicals that are being thrown off, being produced by the cells of our body continually. The Loma Linda Nutrition and Health Letter stated some months ago that every cell in the body, the DNA of every cell, the genes, the genetic material, gets about 10,000 hits every day from these free radicals.
From every cell? In every cell?
Every cell. So, in other words, if you're going to protect yourself from damaged DNA, which is the cause of cancer, then you better be able to get rid of these free radicals. Well, you can do that with this enzyme system that the Creator put in our bloodstream. And this enzyme system, glutathione, depends upon selenium. And so if you don't have enough selenium coming in, then the body's not going to be able to make enough of the enzyme system to protect you adequately.
So this is like our homeland security system of the body.
That's exactly right.
Got to have this selenium.
That is exactly right.
So like my body right now, right inside, it's just popping. There's all kinds of different things happening.
You can think of it that way.
I'm like a popcorn machine.
That's exactly right, and that's why Dr. Brooks at Duke University has discovered that individuals with the highest selenium levels have about a 70% lower risk of prostate cancer than those men with the
Wow, 70%.
lowest selenium levels.
So 70% lower risk, and all those things are smashing around inside, but if you got the selenium, they can make sure that doesn't
That's one of the
impact you.
factors. But again, this is an enzyme system that all of us have, men and women.
Okay.
And so they've actually recently shown that individuals with the highest glutathione activity in their bloodstream have the lowest risk of developing a coronary event, a heart attack or a bypass.
So it not only protects from prostate,
exactly,
but also heart attack.
because these free radicals not only damage DNA, which can lead to cancer if you get enough damaged hits and you get them in the right places on your DNA, but the free radicals can also damage cholesterol, oxidizing it, and that's what leads to coronary artery disease.
So again, what's the highest, give me the top 3 highest foods in selenium.
Well, the very highest food
Yeah.
is Brazil nuts.
Brazil nuts. But aren't those high in fat?
Well, they're high in good fats. You see, the Creator put good fats in the nuts. It's the animal products that have this saturated fat, and it's the packaged foods that have the trans fatty acids. Those are the bad fats.
Brazil nuts. What's another high food with selenium?
Well, before we move away from Brazil nuts, 3 Brazil nuts will have 400 micrograms of selenium, and that is the amount that's being used in a study right now to see if men can actually lower their risk of prostate cancer. So you can join the study and get the benefits before 10 years are up and they finally tell us.
So take 3 nuts a day.
3 nuts a day, or you can get whole grains, red winter wheat, different whole grains, garlic. There's a number of good sources, but whole grains are really the one that you want to remember, and Brazil nuts.
Okay, about that stuff we can eat. What about stuff that we drink, or beverages? I mean, a lot of people in America drink the good old cow's milk.
That's right.
Is that good for the prostate situation?
Well, actually, a very interesting study, the Adventist Health Study. Dr. Jacobson and his colleagues there in Norway found in the Adventist Health Study that men who were drinking soy milk more than 1 serving a day, so 1.5, 2 servings a day of soy milk, had about 70% lower risk of prostate cancer.
So this graphic, help me with it. The soy milk, it says 0.3 there. What's
well,
that?
what you want to remember about the graphic is the shorter that bar,
The better?
The better.
Okay,
And,
so soy milk is 0.3 versus 1, and so you're saying
right.
1 is like 10 minus 3 is 70%.
That's exactly
That's where you
right.
get that. Okay.
So that 0.3 is only a third of the prostate cancer risk of someone who does not drink soy milk, rarely or not at all.
So do you drink soy milk?
Yes, I do.
Do you like it?
Well, I must say this. It's wet and it gets the cereal moist, but I don't drink it as a beverage.
Okay.
But there are some that are reasonably tasty.
So they have this, there's all different types of soy milk.
Yes, there are.
What about the chocolate soy milk?
Well, I'll tell you, some of the better soy milks are going to be those that do not have cane juice as a sweetener, for one thing.
Oh, I see.
Cane juice is a higher...
But this study didn't get into that, right? So if you've been switched to chocolate soy milk, you're okay.
I think as we move along, we're going to discover that probably wouldn't be a wise idea. Because remember, 60% of Americans are either overweight or obese, which means they are insulin resistant, which means if you're taking in refined sugars, and they put more of the refined sugar sweeteners in these chocolate beverages, carob sweetened beverages, then you're going to have higher insulin levels, and higher insulin drives cell division to levels that are
Boy, you took that away from me so fast, doctor. I was trying to get chocolate soy milk for everybody watching, and you didn't quite let us have that.
It might be a place to start.
But switching from the cow's milk to the soy milk is good.
Absolutely.
All right. Well, you can keep that chocolate soy milk just for a couple minutes. You might have to take it away later in the program.
It might be something to start with.
That's right. Okay. Well, let's move on then. What about you said that there's a connection between lowering the prostate cancer risk and sunlight.
That's right. Sunlight, as we mentioned on other programs, individuals who actually are getting the most sun exposure, and that means they have the highest vitamin D levels, specifically the highest 25 hydroxy vitamin D level, these men have the lowest risk of prostate cancer.
So what part of the body should we be exposing? Is this location dependent?
Well, actually, you only need to expose the face, the hands, and the arms 15 minutes, 3 times a week to get the minimum amount of vitamin D that you need to maintain health.
That doesn't sound that hard at all.
It's really not.
But for someone that works night shift,
it would be, for someone who works night shift, frankly, you can get a full spectrum light that does put out ultraviolet. Now, you wouldn't want to look at it, but if you were in its presence, face, hands, and arms, you can make vitamin D that way as well.
So you have a graphic here about vitamin D that we want to look at.
Yeah, I mean, it graphically will show that individuals with the lowest vitamin D levels are at 3.5 times greater risk of prostate cancer.
Okay, so that 3.5 is the lowest vitamin D level, and that shows their risk at the bottom.
Yeah, it shows their risk much greater, 3.5 times greater than those individuals with the highest vitamin D levels, which, the lowest risk would be set at 1, and then the researchers...
What if someone already has prostate cancer or prostate cancer?
That's a very interesting question. In fact, Dr. Dean Ornish has looked, and other researchers at Duke University, for example, have looked at individuals who already have prostate cancer. And they have taken these prostate cancer cells and they've put them into cell culture and they've exposed them to serum of the patients. For example, Dr. Ornish, serum of the patients before they went on a special lifestyle program, and then the prostate cancer cells after a lifestyle program. And for example, one of those lifestyle programs, they simply put these individuals on a diet that was about 10% fat, and that's basically a plant diet, a whole plant diet. It's about what it is, 10% fat. They put them on flaxseed, a couple of tablespoons a day, some exercise, and they were actually able to show that those cancer cells died off faster and they divided less rapidly than before when they were put with the serum before they went on the program.
So if someone's got that diagnosis, go ahead and start doing this stuff right now.
Absolutely.
It will help it not at least progress.
It may help it slow down. It may be less of a problem as far as advancing. You may actually buy some time.
So run outside in the sun, but other than that, but seriously, what is the most important thing a person can do to avoid prostate cancer?
Well, Dr. Singh and his colleagues have actually did a very interesting study on some Chinese men.
Okay.
And they actually took men and they watched these individuals. They divide them into 2 categories. They divide them into a category of the lowest distance around the waist, in other words, the smallest waist,
okay,
the lowest insulin level, and watched for their incidence of prostate cancer. And then they took men with the largest waist and the highest insulin level, and they watched for their development of prostate cancer. And what they discovered was individuals with the greatest waist size and the highest insulin levels had up to 8-fold greater risk of prostate cancer.
I think you have this on a graphic, don't you?
Yes, we do. And in fact, it dramatically shows that if you have a lot of insulin resistance, which means you have carrying a lot of extra fatty tissue in the abdomen, and you have a high fasting insulin level,
you're 8 times as susceptible?
You could be up to 8-fold greater risk of prostate cancer. And this is one of the greatest differences in risk that we see.
So if I see someone that looks like a pear instead of an apple, in other words, they have that
if they have
big
large belly,
and they're a diabetic, and they know that, or even if they don't know that.
Absolutely. Well, those individuals also would typically get prostate cancer earlier in life, and it'll be more of an aggressive prostate cancer. It'll be a higher grade, and so it'll be more difficult to deal with. Many prostate cancers are indolent, and there may not be anything clinically that you can do or that you need to do to really help your situation. But if you're carrying extra weight in the midsection, high insulin levels, those are often more aggressive.
We're talking with Dr. Tim Arnott. We're talking about prostate cancer. It afflicts many people. The same principles, however, that we've talked about in relationship to what men can do to avoid, prevent, or at least stop the development, if it's already going on, of prostate cancer. And doctor, as we were talking about this, you talked about some of the things you do there at the Lifestyle Center in America, or Lifestyle Center of America. You're a physician there and you help people. Do many people come in? Are they diagnosed with this while they're there?
Diagnosed with prostate cancer?
Yeah.
Well, one of the tests that you can do, of course, is a PSA, which doesn't give you a diagnosis, but it can tip you off that perhaps you need a biopsy. So I would say that diagnosis of cancer is not something that we specialize in. What we do is to deal with insulin resistance.
I see.
And insulin resistance is the underlying cause of high insulin levels. Many Americans have very high insulin levels. Insulin is a growth-promoting hormone. It is a hormone that helps to encourage cell division. Cancer is cell division too rapid, out of control, and so high insulin levels can encourage the whole process of cancer formation.
In our first segment, we talked about the fact that selenium can give protection against prostate cancer, and about Brazil nuts and how they're very high in that. Are there any other foods that are very helpful to us if we're trying to prevent prostate cancer?
Yes, and I want to say again that for those women who are listening, we're going to be talking about some foods. These foods are important not only to help us protect the prostate, but to help us protect from breast cancer, from coronary disease. So these are important protective foods for all of the, both the genders and all of this, many of the diseases that we deal with, cancer and heart disease, stroke, for example. And one of these we're going to mention first of all is tomato.
Tomatoes.
Individuals, Dr. Giovannucci and his colleagues have discovered that individuals who take in more than 10 servings of tomato a week have about 35% lower risk of prostate cancer as men who are taking in, 1.5 or fewer servings.
So this is your recipe: pour tomato puree generously over lentil loaf, steamed vegetables, and beans, etc.
You know, many of us are short on time, and yet we don't like to eat our food dry and, and without any real taste, and maybe we don't have time to get the blender out and put together a cashew sauce or a tofu sour cream sauce.
Just tomatoes.
Just open a can of tomato puree. There's no salt added to tomato puree. Many of you have tried to find tomato products without salt. It's very difficult. Tomato puree is...
Just put it over the old lentil.
Pour it over, and it's lycopene is what causes that red color in the tomato. And that lycopene is a red pigment that protects the tomato from the ionizing, damaging ultraviolet radiation from the sun. And when you eat that pigment, it protects your cells from the free radicals that we were talking about earlier in the program. And so instead of that free radical hitting your DNA, damaging it, breaking a strand, which can lead to cancer, it hits the lycopene.
So it can't be green tomatoes, it's got to be red tomatoes.
Well, actually not. Any color is protective.
I see.
Any color is protective. It's just that, researchers like to look at one, for example, and they like to do studies with one. But they've actually shown if you do 3/4 of a cup of tomato sauce a day, you can significantly lower.
Is ketchup protective?
Yes, actually. I mean, I wouldn't recommend that because of the sugar that's in there, and high sugar intake can actually increase your risk of cancer. But yes, the lycopene in ketchup can actually be protective. In fact, many of the foods that are protective of Americans are not really the healthiest foods, but there is something healthy in there, and they still get some of the benefits.
Well, what's the next one on our list here?
Well, one of the other things that we should mention is just dairy products, for example.
Well, we have Brazil nuts here.
Okay, well, we'll talk about Brazil nuts. Brazil nuts, again, are the selenium.
Okay.
The selenium in Brazil nuts is very important for feeding the glutathione reductase enzyme, which job it is to get rid of those free radicals.
Those ping pong balls smashing around the body.
Disease is largely an issue of what you do with free radicals. Whether they just ravage through the body and damage your tissue at will, or whether you have taken into your body these pigments, these colors from whether it's the red of the grape, or whether it's the purple of the blackberry, whether it's the green of the spinach. Spinach is one of the highest antioxidant foods in the vegetable kingdom. And in bringing those into the body can get rid of those free radicals, protecting your prostate, your breast.
What's the next one on our list here? We have, okay, switch from skim milk.
Skim milk to soy, yeah. Recently in the American Journal of Clinical Nutrition, there was an article that showed that individuals who drink the most dairy products, and we're talking about 2-3 servings a day, they have the highest risk of prostate cancer versus men who use the least dairy. It's about a 35% increased risk in prostate cancer for those men using the most dairy. So putting that together with our earlier study by Dr. Jacobson, if you switch from dairy to soy, you're going to get a significant improvement in prostate cancer risk.
Okay, our next thing on our list, we are just going through a number of these. We have choose scrambled tofu in place of eggs.
You know, it's well known that testosterone, for example, increases the production of prostate cancer. In fact, it's one of the reasons why men are discouraged from injecting or having testosterone injections. It could increase your risk of prostate cancer. Well, there are, in the foods that the Creator has made, there are steroid-like compounds. We call them phytoestrogens, for example, phytoprogesterones, phytotestosterones. These are plant compounds that are like those sex hormones, and what they can do is they can bind to the testosterone receptor, for example, or the estrogen receptor in the case of breast tissue, and they can actually lower the overall sex hormone effect on that tissue. And of course, the testosterone promotes growth. Estrogen promotes growth, and so if you can lower the net effect of those sex hormones in the body, you're going to have lower risk of promoting a cancer in those hormone-sensitive tissues.
So moving away from a dairy product towards a soy product would do that?
Absolutely.
Okay, our next thing on our list as we look at foods that protect, use cashew or tofu-based sauces in place of cheese. Oh, everyone's gasping. You're taking the cheese. But are these, how does this work?
Well, actually, it's very similar. You know, the fat, there have been studies showing that the high fat intake, especially the high animal fat intake, the saturated fat intake can actually increase your risk of cancer. And so cheese has more saturated fat than meat, actually. In fact, it has more saturated fat than any other food that's out there. And it actually has more cholesterol than meat as well, by a little bit. So, you know, cheese is something that you don't want to switch to if you're trying to move away from meat. You want to move past the cheese and on to the nuts and seeds, olives, avocado. Those are the good fats, and those are the kind of fats that are going to actually help lower risk of cancer. Our
next on our list we have, as we're moving down, foods to protect, spend 15 to 30 minutes in direct sunlight daily. I guess this has to do with the vitamin D.
Absolutely. Vitamin D, you know, is something that, you know, we've talked about it before, but it's worth talking about again because people really aren't getting the message. You know, we hear about it, but we need to act on this. We need to get out in the sunlight because there are actual vitamin D receptors on the prostate tissue. And in fact, it's recently been discovered that prostate cells are actually able to produce the active form of vitamin D right there in the prostate tissue. We actually thought it was just the kidney, but studies out of Boston University have revealed that the prostate cells are actually able to make this active form of the vitamin D, but they must have the 25-hydroxy to do it. And you only get that when you get that sunlight on your skin producing that pre-vitamin D, which can then go to the prostate cancer.
So vitamin D supplements won't help then?
Well, actually, vitamin D supplements will help. In fact, we would recommend that you do both. That you go out and get 15 minutes of sunlight twice a day.
As you're walking to buy those supplements.
That's exactly right. And that you also, because, you know, the reality is that we are an indoors culture. And I don't know if that's going to change anytime soon. So get out when you can, 15 minutes twice a day. Hopefully you can do that. But also take a vitamin D supplement. And currently it's recommended that we get at least 1,000 international units a day. Now, I can tell you that that probably won't raise your level if your level is low. In fact, you may need to take, in fact, what we do at the Lifestyle Center of America is we put individuals on 50,000 international units once a week for 4, 6, 8 weeks, get their level up to about 30, 40, 50. That's the safest level, and will give you the lowest risk of prostate cancer in these epidemiologic studies.
So it can't get too high. Someone has said over 150 is too high.
That's correct.
So if you're taking any kind of supplement that's not a water-soluble type thing, or you don't get rid of it by urinating, you need to make sure and get that level checked now and then.
That's
right?
correct. And actually, to be very honest with you, it's going to be very difficult for the average person to get a D level that's toxic, because researchers have actually shown that you need about 10,000 international units a day to get to a toxic level.
Two questions I want to ask you. One is, what do these recommendations do to help a woman's risk against cancer? And then lastly, what kind of screening should we be doing? And we have about a minute and a half.
Well, if we talk about vitamin D, for example, remember that our vitamin D levels, the highest vitamin D levels, are not only helpful for men, protecting them from prostate cancer and colon cancer, but women with the highest vitamin D levels also have the lowest risk of ovary cancer and breast cancer. So that's important. Lycopene is important not only for the protection of the prostate DNA against damage from the free radicals, but it will also protect breast cell DNA and ovarian cell DNA against the damaging effects of free radicals.
So this is a program for women as well as men.
Absolutely.
Now, I want to put up that last graphic about a test that we need to have. What is this test we need, and when do we need to have it?
It's a prostate-specific antigen test. It should be done at age 50 in a man. And if you've had a family history of prostate cancer, then at age 40. It should be done with a digital rectal exam where a urologist or other physician puts their finger on your prostate and make sure there's not any hard nodules or something that would indicate a cancer.
Even after 40 is okay, right?
Absolutely.
We've been talking to Dr. Tim Arnott. He's a physician at the Lifestyle Center of America in Oklahoma. And we hope that today's program will help you avoid prostate cancer and that you'll have health that lasts as a result for a lifetime and beyond. Thanks for joining us.